I'm going to talk a bit about what kinds of alternative products I suggest to my patients on a regular basis. We always go over whether they're taking supplements and what kind of a diet they're taking, but when there are challenges and patients are suffering from an infection of some kind, what are we going to give them that isn't going to be an antibiotic, for example? In the years past, we all thought it was echinacea and golden seal, but after a lot of reading, they're really not that helpful. One of the things that I prefer a lot is called colloidal silver. Historically, people could make it themselves, and if they weren't well made and the particle size was very large, they would actually turn kind of blue. And they kind of looked like the Tin Man. Not a good look for most people. So, but the ones that are manufactured out now really do very well. And for infections, what I like about it, first of all, it's a clear, almost tasteless liquid, and they're able to put it in their mouth. So if there's an infection locally, they're able to actually put it around that area and use it very effectively for, a few days at a time. Some people will take it, even when they have a cold, they'll take it every, 4 or 5 times a day for a capful or a teaspoonful. And we see really good results. I see really good results with the colloidal silver. It's typically very well tolerated. It's not going to wipe out the whole bacterial system like a regular antibiotic will do. And I find it's really helped a lot. Some of my patients I will also recommend, if there's a heavy-duty infection going on, olive leaf extract I have found to be really effective, and it's available at any of the, local health food stores whose names shall be unmentioned by me, because God knows where you are, and you may not have the same health food stores that we have. A lot of it's available on the internet too. So olive leaf extract, 2 to 6 capsules a day, depending on the severity of the infection, your own tolerance. Some of my patients are so sensitive that I can use 1/3 of a capsule, 1/3 of a carpule of anesthetic, and that's too much for them already. So everybody is very different in terms of what they can tolerate and what tolerate. So colloidal silver, olive leaf extract. Hypericum is a homeopathic that is very helpful for nerve pain. So if there's a lot of pain, arnica is another one. So hypericum and arnica. A lot of patients will prepare all these things ahead of time before they have an extraction, before they have some dentistry done, and they start taking these things in advance so that they're able to open up the system and to a different level before they have to go through the difficulties of the dentistry that has to happen for them. The other thing I happen to like a lot, there's a cream that used to be Tramil cream, which is now called Tea Relief, I guess. It's an arnica cream. It's great for people, they're sitting in a chair. When do you keep your mouth open for 20 minutes to an hour at a time? You don't. So the jaw starts to hurt, the muscles get aggravated, people are uncomfortable. We put a little bit of that cream on those jaw joints and it's just all better. But that cream is great for all kinds of stuff. Put it on necks, you can put it on shoulders, you can put it all over. So I like that a lot as well.